Let me know if you see it being live. Vanakkam and welcome to Inia TV Loud and Clear, the panel discussion that we've been waiting for. Today, we're going to talk about how arts and crafts would involve in a child's development and how it can influence a better development. It is every parent's fear when they have a child to see if their children will match the age-appropriate norms or follow a particular yardstick, especially if there are two kids in the neighborhood and one achieves a particular milestone and their child is not there yet. It can lead to a panic situation. Now, how does art and crafts, which is introduced in school at a very early age, influencing a child's development? Does it do anything different from a child who is not or deprived of art and development? We are going to talk to a few specialists here, right from the medical field to health science and special education, and see how arts and crafts can help with these children. To begin with, I'm going to ask the panelists to introduce themselves. And maybe I could start with Dr. Adhd, if you can go first.
Hello, namaskar. I'm Dr. Adhd and I'm a medical faculty at Institute of Postgraduate Medical Education and Research under West Bengal University of Health Sciences. So I teach medical physiology and I'm a practicing physician. Along with that, I also do dance and movement therapy. I am a guest faculty at Tata Institute of Social Sciences and have developed a module of dance and movement therapy for people with developmental differences known as Samya module of dance and movement therapy, because I'm a big supporter of expressive arts therapy and I think that goes a long way in the holistic development of a child and adult, and especially those who are dealing with a lot of challenges. And along with that, I'm also a mother of someone on the autism spectrum, which has inspired me a lot to get to what I'm doing today. Thank you very much.
Thank you very much, Dr. Adhd, for taking your time to be on our panel. Next, I shall call Ms. Subbalakshmi. Please introduce yourself.
I'm Subbalakshmi, a special educator in the Department of Special Education from All India Institute of Speech and Hearing. Thank you.
Thank you. And Mrs. Manjari, please.
Namaste. My name is Manjari Kadle. So I'm an occupational therapist with the schools in in Austin, Texas. I work with kids with autism, with kids with developmental disabilities, and then also with our regular kids who have issues with handwriting or fine motor coordination or visual coordination processing issues, or even sensory integration processing. So that is my background. Thank you.
Great. Thank you very much. Next, Mr. Logesh, who's going to be a doctor pretty soon.
So hi, thank you for having me on as a panelist. Myself Lokeshwar, and I'm working as a speech language pathologist at Sri Devaraj Academy of Higher Education and Research, Kola. So I completed my master's in 2017, and yeah, from then I've been working as a speech language pathologist with various children and adults as well.
Now that I have you with the center of attention, I've heard a lot about your skills with origami and other kind of artworks that you do. So I'm going to start off with sharing what I have taken from your Facebook page, and I'm going to share that with the group. And here are some of Lokeshwar's artwork. Notice that you have a miniature origami sitting on his fingertip. I guess it's a butterfly.
Yeah, it is.
And we'll go with this one. What kind of artwork is this?
Okay, yeah, that's a paper cutting.
Okay, wow, that's quite intricate. And that's amazing. That's another paper cutting, I guess.
Yes.
All right.
Actually, all these paper cuttings, I drew them initially and then I had to cut them out.
All right. And are these regular normal paper or are they special paper for that you would use?
No, I just use a regular printer paper.
Okay. And that's spider web.
Yeah.
Okay. Great. And this one is origami.
Yeah, they're called as tessellations.
Tessellation. Okay. What do I see? And okay, yes. And again, another paper cutting.
Yes.
And back. Oh, I thought I added one more of yours. Let me pull that up. And let me save as. And oh, it is there. Save. Yes. And I'm going to stop sharing and start sharing again, because this one is, there we go. Wow. Tell us what this one is.
This is called as 3D origami. So it is, we fold small triangles and then we join each and every triangle pieces to make it a big 3D origami. So this is a ship which has somewhere around 1,500 pieces or more than that, I believe.
Wow.
Yeah.
How long did it take for you to finish this?
I used to do this during my free hours. So I kind of took around 20 to 30 days, nearly a month to complete it.
Okay. And since when are you doing origami? Or how did you learn? How did you get the idea to learn origami?
Yeah. So from school days, we had this art and craft classes, right? So there they used to teach us all the small crafts such as the boat, aeroplane, which is common among all of us. So the special interest that I got into is when I was in my 5th standard, and one of my cousin taught me how to do a camel. And I believe this is the camel, so I don't know whether you can see it.
Okay, yes.
Yeah. So I mean I can. So this is a camel that I had been doing from my 5th grade. So from then on till for around 7 years or so, I had been doing the same camel, and the interest towards it increased even more when I did this camel for one of the child who has autism, and then he was able to identify it as a camel. So that is when I kind of interested me a lot in doing different models, because it's not common for a child who has autism to identify an object made out of paper, right? So it's kind of difficult for the normal children as well. But then when a child who has special needs, and if he can identify it, then I felt that was actually great. So that is what made me do most of the things that you see on Facebook. Yeah.
Okay. And when you practice origami, do you feel that you have to practice n number of times to master it, or does it come easy to you?
I kind of get it at the first try or the second try. So I kind of see the books first, because in the books is where they give step by step, right? So I kind of look at books and also certain videos on YouTube. So by looking at all of them is when I fold. And also while folding, what happens is like you kind of get frustrated when you don't get this step, right? Especially if it's in a book, they give instruction that this is how it is to be done. And if you don't get the fold right, you don't go further, right? So until and unless you get that step right is when you can complete the model. So yeah, it was kind of frustrating initially, but as and when I started doing different models, I kind of got a hang of it, and then yeah.
Okay. And apart from just doing origami, I also noticed that you do miniature versions of that.
Yeah.
Where did that spark come from?
No, I kind of saw another friend of mine who was an origami artist. So I saw him doing a couple of origami, like a miniature ones, but those were not so tiny. So I kind of took it as a challenge to do it around 10 millimeters, 10 square millimeter of a sheet, or around 15 millimeter. So I thought that would be even more challenging, because getting the folds right in such a tiny paper is quite difficult. So I thought that would give more challenging. So that's why I kind of did that.
Wow, with fine motor control and attention span, memory, and all these, being a speech
Yes.
pathologist, have you tried this with your patient load, kids especially?
Yeah, I kind of tried it with a couple of children. Okay, so wherein it kind of increased their attention span and also the concentration and eye-hand coordination as well. Because in order to do certain things, you need to know how exactly it is to be folded, right? And until unless the folds are proper, you'll not achieve the final product. So they need to have a precise folding, and they need to know different concepts such as the symmetry on how well it is. It should be similar on both the sides. So until unless it is similar, it will look better. If it is asymmetrical, then the image will not look good,
Right.
right? And yeah, and also I tried with one patient who had stroke. So it kind of helped him in developing his motor skills as well. And also, it kind of helped him a little bit in language stimulation as well because it stimulates both the hemispheres. So, as and when you use both the fingers, I mean, sorry, as and when you use both the hands, it kind of stimulates both the hemispheres, targeting all different parts of the brain.
Mhm.
Yeah.
Great. Okay. Talking about brain and attention deficit and all those, a parent
Hmm.
will first rush to a doctor when they have seen that their child is not matching the norms or yardsticks. So I'm going to call Dr. Aditi and ask what kind of patients she would see, or especially with kids, and what would her advice be when a parent walks in and says, "My child is not walking right or talking right or is not matching with in development with my older sibling or my friends kids." So Dr. Aditi, if you would let us
Yeah.
know what you
Yes, I do get to almost every day. I get to talk to a set of parents coming to me or approaching me nowadays in telemedicine communication, that this is what is happening to my child. And moreover, what happens, I feel that nowadays parents are aware. That's the best part of it, that they get to understand that my child is not at par with my neighbor's child, as you said, or with my older sibling. But then again, in Indian context, there's an extended family, even if people live in nuclear families, but they're very, and I think it's also all over the world, they are very connected to their set of relatives. So where comes people who are elderlies in the family, they would like to say that, oh, that is going to be all right with time. In our family this has never happened, someone talked late, someone walked late, and so you keep waiting. And parents come, with a lot of guilt in them, that somewhere the parenting has been wrong, for which the child is having delayed milestones. So the first and foremost thing that I do when I talk to parents, I said that you are the parent, you are the dad or mom, and you have found it out. So just obviously be confident about your findings, and definitely there is something going on with the child. Even if it is not, it needs to be assessed. So assessment is a very big part of it. Even there are quite a number of authentic online questionnaires. For autism, we all know MChat is there, and for other developmental disabilities, other questionnaires are there, which I ask them first to do, because, and in an unbiased way, the parents, mother and father, they do it separately, and they come up with the scores and talk to me. So that kind of, validates their findings. They feel okay, then my concern or my doubts were right, founded. It's not that I am somewhere going wrong. And then I call them, I talk to them, I assess the child, and if the child needs referral, we refer the child. But what I tell them, that there's no quick fix to this problem. Even if the child is on a borderline, because people want to, when if they have found a problem, then they tend to say that, oh, I think, will it be okay someday, will they become normal? And they, within inverted commas, still we are yet to find out what actual normalcy is. So I tell them it's a long process. So gradual, it's a very gradual process, because first the findings, then comes denial, finally acceptance, and it's an entire family that needs to be counseled. So I also talk to grandparents and the caregivers, and gradually the process goes on.
awesome. And I'm glad you mentioned that it's a gradual process.
Yeah,
Do you think usual questions from parents are, is there any medication? Can I give a
yeah,
pill or any treatment,
yeah,
surgery?
yeah, yeah,
How
yeah.
would you convince them that that medication is not the route of treatment here.
Yes, yes. See, what happens is that there are nowadays parents. As I said, the best part is parents are aware. Parents are very educated. They are qualified. So that makes them, Google through a lot of information, which at times is not so good at the same time, because they do not rely on one single therapist or physician. They keep on, I call it, therapy shopping. So they move from one place to another, and they do not stick to someone else. And in India there is a lot of options for doing so. As you know, I've stayed in US, and there, there are a lot of regulations of insurance, and so it's a good thing that you actually cannot go and hunt out for therapists like that. But in India it's a different culture. And secondly, they go for a lot of investigations. They subject their child to long hours of MRI and a functional MRI, which is actually not that much required once there's a diagnosis. So it takes time for them to understand. And in our fraternity, I would say, among the health professionals, this trend is more about, trying to go for the diagnostic part of it than the therapeutic part of it. And a long time is wasted in the process. So I tell them, you go for diagnosis, you go for assessments, and it needs to be done to get a proper diagnosis. But before that, start interventions. Because interventions in the form of special education, speech therapy, occupational therapy, behavioral management, they are going to help any child, be or be not on any developmental different spectrum. I believe that way. Rather, I would share, I feel when I learned for my son a lot of techniques of special education, I felt that in my childhood, if I had the scope to learn that way, then I would have rather had a better foundation of education than what I gathered when in the learning process throughout my life.
Interesting. And you've just segued the right way to Mrs. Carley, our occupational therapist. I'm going to ask her to talk about what kind of exercises or what's her advice to a parent who walks into a clinic with developmental delays or questions about their child's development.
I agree with what Dr. Aditi said, that the process starts with with a diagnostic process. Once we have identified a diagnosis, we're able to set a baseline and then try and help the child move forward with wherever the baseline ends. And then, of course, the ultimate goal is to try and get the child to age level, get them to appropriate motor skills to whatever is their age level. So, again, depends on the child, depends on the family, depends on what kind of setting they're coming from. I've worked with children as young as 6 months, working on things like rolling and sitting and making eye contact and working. And then I also worked with children up to, 25, 30. I mean, I call them children. I mean, they are childlike, but they're adults, working with adults, also working with adults with strokes. And so you see, rehabilitation or habilitation is a different format for wherever that child is coming from. A lot of what we do is, to give parents tools on how they can help their kid. So, I'll work with the child for an hour, whatever hour and a half my therapy is, once a week, twice a week. But then the rest of the time, that child is in care of their parents or at the school or in a school setting. So a lot of what we do is, we work with the child directly, and then a lot of what I do is caregiver teaching, is to transfer some of that knowledge to the parent or to the teacher or the caregiver, because they work with that child on a daily basis, and they are able to follow through and reinforce so that the learning and the teaching happens. Children are an amazing medium. They are resourceful, they are adaptable, they are willing to learn, they're wanting to please. So, finding a medium that works for them, coming down to their level is absolutely wonderful. And then trying to find, what works for this child. Not one thing works for each child. So you work on different where that child is. But the therapy process hopefully moves them along the developmental level, brings them to where they need to be so that they can work on things like sitting, standing, transitions from from crawling to standing, being able to walk by themselves, being able to rotate to lean down to pick up a toy and then come back up to a standing position to interact with whatever toy, using both hands in midline or off midline in a rotation or in forward leaning or whatever, and being able to maintain that balance. All of these pieces, all of these components have to come together so that the child is functionally able to interact with their environment. So a simple process of picking up a toothbrush, brushing my teeth, spitting it out, rinsing my face, all of those simple things take multiple processes, multiple steps, and working with that child on a daily basis. Let's try and do this. So you work on ADLs, dressing, bathing, eating by yourself, doing all of those things. So that's what occupational therapy does. So it's absolutely wonderful. It's very challenging to see a child be where they are, and then it's very rewarding to bring them forward and to see them gain skills and make amazing progress. So that's definitely a very fulfilling part of what I do. So so that's what OT does.
Wonderful. And talking about children and school, a child is 8 hours in school, sometimes more than that. And by the time they come home and parents get ready to be with their children, it's bedtime. So I would say that children spend most of their valuable time, more energetic time in school.
In a
and
school setting.
A school teacher plays a huge role in their development. We do have our special educator here, Mrs. Subbalakshmi. I'm going to ask her about what she thinks about arts and crafts and a child's development in general. Mrs. Subbalakshmi.
Thank you, sir. Actually, speaking, art and craft has a great influence in children. Is it audible now?
Yes, yeah. Now it's getting out. Yes.
So it has a great influence. Specifically, we can think about the overall development of the child. If we can attain it through art and craft. When we come to the specific, for example, in education, when we take the process of reading, we want to introduce the skill of reading to a child, then it will be like when art activity is introduced, the child's attention, be it concentration, or these are all prerequisites for reading. So the child will automatically get to know about it. The observation skills develops. All these can be done. So naturally, we can wean the child out of the screen time or something, and then get into the reading part, whether the child will enjoy reading. So this could be attained through craft also. And for when it comes to writing, the same thing. The prerequisites will be attention span, the child sitting posture, fine and gross motor development. All these happens naturally through art and craft. So when this is introduced, the cognition of the child is developed. The child gets to know this environment. Actually, now in our preschool, in AISH, Department of Special Education, under Dr. Pushpavati's guidance, we have created a lot of craft items which is displayed there. It could be based on the professions or public places. A lot of things are there. Earlier, we used to see that parents, when they come for an assessment, they just sit in a corner in a very sober mood. They won't know what to do with their kid. It was just a silent thing. They'll think that some assessment is going to go on. So it is already decided what the child has here. It will be like whether the child goes into a infant program or an empowerment program or something like that. But then the parent will think that something else is going to be assessed, and they'll be so stressed out. But now this environment of art, craft, it is all around. So now the self-learning is happening. The child goes to that place, tends to point out what is there. So the parent also get a chance to speak about something. So all these things happen very naturally. So although teachers who cross them, we also are able to encourage, come on, talk to the child, tell them what it is. And then the recognition part happens very naturally for the child. All these things are good. So that's how in education, in any education, be it early childhood or elementary level, high school level, any place, craft can be used as a mode of learning, teaching the child. So I think that.
Thank you. And talking about art and craft, it might look very simple and something that is not significant, especially somebody who does not understand the connection between arts, craft, neurological development, motor development, social development, and all those. I want to give a taste to them. I'm going to ask our origami artist, Lokeshwar, to give a demo of one of his models. And that might show you how many folds and how many intricate motor work is required to do that. So let me put him on spotlight. And yes, Lokeshwar, whenever you're ready, we would like to watch you, and maybe I'll try to follow you while you're doing that.
Yeah, so it would be better if the other panelists as well do it.
Sure, yes. All of us feel free to let us know instruction-wise. Do you need a square sheet or?
A square sheet would be better.
Yes, I've noticed that that's the most common sheet for origami, right?
Yes. So today I'll be demonstrating on how to, how to do this snake in a box. So this is how it is. It just pops out like this.
Awesome.
So I chose to do this because since we are dealing with children with in the development, so this would be a little bit helpful for children to get their attention towards us. Okay, because doing just any other model would be a satisfaction for us, but then doing an origami which can be used to play will be much more helpful.
Yeah.
Okay.
Okay.
Yeah. Just give me a minute. Let me just adjust the camera.
Sure. And those who are watching live on YouTube, if you are a speech pathologist, occupational therapist, school teacher, special educator, or a parent, and you have any questions, comments, your experience, please share with us on the live chat, which is on the right side, and I can read it out for the rest of us. Thank you very much. Okay. Oh.
So, is it clear enough?
Yes.
Can you see it?
It starts focusing when your hands are right on the paper, and maybe if you do it slowly, the focus will stay there. And
Yeah.
yes, kind of blur, but yes, it's getting better.
Since I'm using my phone, I think it is auto focusing.
Yes.
Okay. So let me just start off with it. So
Sure.
once we take a square sheet,
Mhm.
we can fold it into half. So once we fold it into half, we need to divide this into 4 more portions. Okay, so we divide this into half and half of it. Okay, so we'll just bring this end to this end. That is like this. And then let's open it. And then now we can see a crease here in the center. So let's bring this end to the center and as well as this end to the center.
Okay. Those who thought that origami is easy, here you go.
Okay, so now that we have creased, or now that we have 4 different parts, let's open it up. And then let's bring these 2 short ends to the center and then crease in the middle. Okay, so once we crease it in the center, the same way we have to get the other sides to the center. So here we are going to divide it into 8 parts. So this to the center over here. And then let's just turn it and then bring the other end to the center. So now we have 4 ends. Now we have divided it into 4 parts. So this we are going to divide it into 8. So now we have 3 creases in the center. So what let's do is, let's bring this right corner to the one which you see here on the left. That is the first crease. So let's just bring this end to the first crease over here. So that goes around like this. So, and then let's create a crease over here. Let's open it up, turn it around. And here again, you should crease it to the first one. So let's just bring this end over to the first crease. And then let's flatten it. So now we have these two as a rectangle and all these as squares. So let's bring this end to the last crease over here. So it goes on like this. And then turn it over. And repeat the same on the other side. Okay. So I'll repeat from the beginning. So once we take a square sheet, so just fold it into half, you get a rectangle, and then divide this rectangle into 4 parts. So fold this in the center like this, open it up, and then bring the long edge to the center like this, and the other edge to the center like this. So once we created this, we open it up and then bring the short edge, let both the short edges meet so that we create a center crease, open it up, and then we crease it along. So this goes to the center and the left side goes to the center. So we crease over there and then open it. And then you'll have 3 creases. So you can bring this short edge to the first crease and then flatten over here, open it. And then here you'll find another crease. So bring this edge over here and then flatten the image. Then you'll have 4 squares and then you'll see 2 rectangles over here. So bring this short edge to the last line over here, crease it, open, and the same thing on the opposite side. So we do that over here and then we crease it. So once that's done, so we'll have all we see here are the squares. Okay. So now what we are supposed to do is take up the 2 corners on the right side. So you see the second square on the right? So you just bring this line over here and let it meet this line. So how it goes about is, you have to bring it here. So this line meets this crease, and we're going to crease only in this first square, not entirely. We're going to crease only in the first half. That's in the first square. So you just fold it here and then crease along only the first square like this. So we don't crease it along, we just crease along the first square. We're going to do the same on the opposite side. So just bring it here and then crease only the square over here. Okay. So what we did was, we brought this 2 squares. So this line meets this line, and then we are creasing along the first square. And the same thing we do over here. So this line meets this line, and then we are creasing only this square. Okay. So once we do this, we fold this along here. Okay. We're going to flip the model and then fold it over here. So we're going to reverse fold here. So once we fold it, you can see this folding over here. So it just sits along. Okay. And the same thing goes to the opposite side as well. So we're going to fold it over here. So as and when we fold, we get these two creases. So let these two be over here. Okay. So I'll repeat for those who have confusions. So we first created these two creases, and this we are folding along. We are flipping the image, flipping the object, turning it, and we're folding along this line. So once we fold along this line, so we can see this popping up over here. The same we do on the opposite side as well. And then we see these two popping up. So let this be here. Don't flatten the image. Don't flatten the paper. Let's flip it again. Okay. So now this end, we have two squares. So these two squares, let's create a diagonal along these two. Okay. So you see this first line over here. So bring this edge to the center. So that goes like this. Flatten it. And then this edge comes to the center over here. So it comes something like this. Okay. So it comes something like this. So once this is there, we'll have to open it up. Okay. So here, let's open the papers over here and we'll push this edge towards the center. So we are going to fold it inside. So what we did was we creased on the outside and now we are opening it and pushing this corner inside. Okay, so once we push this corner inside, we'll get something like this. Okay, and then we fold it in. So now we have the mouth over here. Okay, now we have the mouth. So what let's do is, we see a line here. So fold it. And then we do a zigzag pattern over here. So since we folded here, we're going to fold the other way around. Okay. And then this edge comes like this. And then it keeps repeating. So we are creating a zigzag pattern over here. Okay. So the last one goes inside. Okay. So here what you can see is I've created a zigzag pattern. Okay. So that's all. Here we go. So let's just draw two eyes for a sweet snake. And then yeah, so let's just draw an eye over here and an eye over here. And here we go. So what happens is this, you'll have to hold here. Okay, so we have a box like thing over here. So we hold in this folds. So once we hold in this fold, what happens is the snake stays inside the box. And once we release it, the snake just pops out. Okay, there you go. Wonderful.
Wow. There you go.
Yep, that's good. Good job.
Thank you. Thank you very much. And I'm sure you all noticed how many steps were involved and how intricate the folds were. It was just a small square sheet of paper, but I'm sure it requires a lot of motor control, memory, and attention, all three which are very important for child development, especially speech, language, motor, social. All these skills get better with what we just saw, with just paper folding art. I'm going to throw this question to Mrs. Carley. Um, these fine motor control movement, if there is a child who does not have this fine of a control, is it possible through therapy to improve their fine motor skills?
Absolutely. And I want to first and foremost say I was following very closely, but somehow I still messed it up. So I need a few more lessons on that. But yes, you have kids who struggle with you were talking about sequencing, following directions, being able to, and then eye-hand coordination is such a huge piece, being able to bring your eyes together into the center, being able to focus, figure out where the individual folds are, being able to follow along that pattern. That can be quite challenging for even a regular person with normal development. That this is a great activity for children because it's a high success. After they've created something, they even on paper and pencil, even on using regular paper, they can take it home, and this is like a high success activity for them. So yeah, I've used origami with a lot of my kids. I stick to very simple folds, like even a plane, if they can achieve a plane or a boat, or a simple, like my daughter is big into making cranes, and I've tried making cranes with a few of my patients, and I don't know if you could see it. Anyway, it's there. It's a crane. So we had gone to Japan a couple of years ago, and this was one of the things that she learned from one of her friends there. So that is an inspiration. So origami is an amazing medium. Any kind of arts and crafts is an amazing medium because it's a natural medium to play. There are so many tools that we can use. Apart from paper, there's clay, there's Play-Doh, there's we use a lot of dough using just flour and salt. So there are lots of things that you can do in different mediums using the art medium. And of course, origami is such a huge piece of that because you can make a simple simple thing which becomes a child's toy. Write something in the middle. We used to work on this with colors or with light, with letters or with reading, putting words in the middle, and then you have to use coordination to coordinate to figure out how to do this. So again, the eye-hand coordination piece, the cognition, the following the steps, remembering the sequencing, being able to follow auditory and visual directions from somebody else, whether it's a piece of paper, whether it's somebody who's actually modeling, showing you how to do it, being able to stay on track with what that other person is doing. All of these pieces are extremely challenging for a child who already has limited fine motor skills. So, using adaptations, like maybe using a bigger piece of paper, maybe using less steps, a less complicated piece, and then moving further up along the line. Always one of my goals when I work with a child is always find a high success activity. Start off with a high success activity, give that child a sense of accomplishment, give them a sense of achievement. Once they have that confidence is for children is just the same as it is for all of us. If we're not good at something, if we try something the first time, I remember the first time I ever cooked something, I burnt it. I burnt it badly that I never, ever wanted to go to the stove again. But my mother would drag me back there. You try it again. The first time I ever made something, it was horrible. But if she had not been right there to encourage me, like, let's try something high success. Like the first thing you make is rice. You cannot mess up rice. There is no messing up there. It's very easy. So same thing with the child, giving them an origami task, like making a simple plane or making a simple a boat or a hat. Those are all very simple activities, and then moving them along that path to something a little bit more complicated, like this little, I'm sure all of us remember these from our childhood. You write stuff in there and you can open it up, or then moving to something more complicated like a crane. Or my daughter makes these little boxes, and I love her talent because she can fold these little squares, and there's no way I can quite do it that way. But that's why arts and crafts is such a fantastic medium, because it's such a great medium to encourage kids, especially with the colorfulness of them, the patterns, the challenge to try and do something. So bringing their fingers together and being able to complete a complicated task is still a high success activity. And then transferring those same skills to a paper and pencil and being able to work on, writing your name, writing your letters, writing on the line, staying on the line, applying enough pressure. All of these pieces come in play for just a simple task like writing your name on a piece of paper and not going through the paper because you put too much pressure, especially some of those cheap notebooks that have very thin paper. And I always used to go right through because my pressure was so much. So again, all of those pieces are important. So with children, you really have to think about what kind of activity. You have to bring it down to their level. Always make sure that the activity is high success. That is extremely crucial starting off. And then as you get to know the child, as you get to, as they get to trust you a little bit more, you build that rapport, then you start making it more challenging. And then you bring in those pieces with more complicated patterns and folds, or more challenging, whether you're sometimes I've literally taken something and I have broken it into pieces and glued them and helped the kids glue the thing together because they couldn't quite get the fold right. So again, you find the medium that works best for your kid, you find the activity that meets that level, and then you slowly build it up so that that child grows with you. Does that answer your question?
Yes, absolutely. And
Okay.
all the tasks that you mentioned are usually taken for granted in a home base, but I'm glad we have a field called occupational therapy to help kids who are struggling with that.
An interesting fact that most people don't realize is that occupational therapy, its base came out of arts and crafts. So during World War I, there used to be these nurses that were called recreational aides. They came up with activities to keep the soldiers who had been injured on the field entertained. And so they came up with different crafts that these people could do that would occupy their mind and get their fingers working and get their body posture improved. It became a part of their rehabilitation. And so, again, moving from being upset that they have lost a limb or they're not able to do what they could do because they're injured, and this was along their this was their rehabilitation path. So that's where the word occupational therapy came from, things that are meaningful and purposeful. Mm-hmm. So arts is a natural part of our service delivery. So I thought that was interesting.
Yes, thanks for that information. I didn't know. I'm not sure how many of our audience knew that. Talking about attention span and memory and all those, I have heard that many parents with ADHD, attention deficit hyperactivity disorder, the parents have mentioned, oh yes, he's under medication, it's now under control. I would like to ask Dr. Adhd Bandyopadhyay about medication to control hyperactivity and their effects and side effects.
That's a very good question. But before you come to it, because we watched this beautiful piece of origami made by Dr. Lokeshwar, and we were hearing Dr. Kali, and it was as Dr. Subbalakshmi also mentioned about recognition, natural recognition of objects through art and crafts. I would like to mention that people just forget that we all know about neuroplasticity being medical professionals, but what I always tend to tell parents, explain it to them that our brain is also a big Play-Doh. So when they are small, till the age of 4 to 6, the brain is very malleable. So more and more we expose them to different interventions, especially through perceptions of our 5 senses that we have. And those based on tactile stimulation, it helps in development of the brain to a big extent. The neuroplasticity works, and the neural networks, which are probably a little aberrant from the regular flow, which causes these developmental differences, they tend to align themselves in such a way that we now know that even there is neurogenesis, new growth of nerves. So that is stimulated to a big extent through arts and crafts. What I would also like to mention is some parents, they get parents always set up very high standards for their children, and there comes frustration out of that. So to keep the expectations quite low, set up very small challenges, very small goals, and enjoy the process of art and craft together. That is very important, because if there is someone just like an examiner watching the child, if the child is able to do it or not, then it's never going to work. It can be as simple as making, drawing on a board of sand, or just doing it for nothing, or messing up the entire thing. And I'm sure in occupational therapy, you do a lot of things with water, sand, coarse textures, fine textures. That helps a lot. And it also helps in proprioception, that is development of vibration sense, which even we know in the temporal lobe of the brain set in this part, it reinforces them. Research has proved it. Now comes to medications. Parents always, as I said, want a quick fix. And in ADHD, many of the times, yes, children need to be kept upon medications. Sometimes they are given medications before school hours so that they are calm and their attention is focused. But I always say that if medications are necessary, they should be given, but at the same time it has to be kept in mind that we cannot escalate the medications for a long time so that it keeps reaching its threshold level, and gradually it doesn't work at all. So we have to work on other measures to, kind of reinforce upon this. The medications give us, it's kind of a tool to help us calm the child. But for each and every child, medication is absolutely necessary is a myth. It is not that. Medications are essential for many of the children, for many of the adults having developmental differences, but it is not that it won't work without medications. Rather, therapies, and again, many of the people with developmental differences, if they do not have a visual challenge, they are visual learners. So, for them, someone who has not been exposed to water or the sea, we cannot create an expressive art therapy medium showing the sea. As you know, if I have never seen a sea, what a sea is, I would never be able to make ripples out of water. If I have never seen a river, I cannot make ripples out of a piece of cloth. So, I always suggest, I work with a group of therapists also, and I tell them that, to build upon the imagination. We say people with developmental disabilities do not have proper imagination. No, it is not that. They do have it. But it is that we have to facilitate the process of expression. So we have to give them a lot of visual cues. And for arts and crafts, it's not necessary. They need to, as we know that working with scissors, tearing, these develops their fine motor skills. But it, again, I tell every parent, you don't have to shop around to get the tools for arts and crafts. It can be from very simple things. It can happen in your kitchen garden. They can make molds, and they can make something. They can even roll some piece of mud or clay in their hand, make a ball out of it, and then throw the ball, and then it smudges, and if it's soft, and make a circle out of it. And then when children also develop confidence, as Dr. Kale said, they develop confidence once they have they have achieved something. So gradually we can move on to more complex processes. Of course, it is always unique and customized for every child, because every child is different. I always believe, although they have a certain diagnostic frame, but we cannot put them in the diagnostic box every time. They have special challenges, they have special talents.
Okay.
So medications are essential at times, but they are not a supplement to therapies. So they might help in facilitation process of the therapy if it's needed. But I always say therapy and therapy are the must for persons with developmental differences and special education. I consider that also a part of therapeutic mainstream for this entire spectrum of developmental differences. That works best. So it people have to work as a team. It's an interdisciplinary team. Just like it takes a village to raise a child, it takes a group of special educators, therapists, psychologists, doctors together, and the family. And parent training is very important. That also I insist upon. Parents, family members need to get trained. They are the most consistent therapists. So that if a child's day is structured properly with such engagements and also fun activities, then growing up is fun, and raising a child is an absolutely enjoyable process.
Well, well said. And I'm glad that you mentioned about the team approach, including the family, because usually, at least in the past, when the child is with a therapist, the parents are outside the room. But I'm glad you
Exactly.
mentioned that they should be involved and integrated as well. And in your previous comment, you mentioned that if at all we had this kind of arts and crafts in our school days, our learning and development would have been different. I totally agree with that.
Absolutely. Absolutely. Because
We,
when just mentioning, when we learn tens and ones, the concept of tens and ones. So we at least in mother education system I grew up with, we knew O and T, and in those days it was tens and units, U and T, and we put them there, the numbers, and we never realized that what actually ones and tens meant. So we could easily say 90 is 90. But when I talk to my child will say it's 9 tens and 0 ones. Why is that? Because we worked on that concept. We worked on that concept with flowers, with pebbles, with toothpicks, and bundle it up together with rubber bands. And it's such a clear, concrete process, I think, which every child should go through.
Yes. And in school those days, I'm sure even now, when it comes to rank, it's just English, math, science, and social that would be put together. Arts
Yeah,
and work experience would be left out. I wish they bring that back in and put that with the rank so that the child will be motivated to learn
absolutely.
more. So, and talking about
Absolutely.
arts and craft in school, it is definitely going to be difficult for a special child. Now, just that what we saw with all these intricate steps and folds and memory and attention, how are these children coping in a special education classroom? I'm going to
May I
ask.
just take a minute to mention one more thing?
Yeah,
Mention one more thing.
absolutely.
Rather, I feel in rural culture all over the world, globally, the traditional concept of education, which was home-based learning, there a lot of in there, lot of importance was there in art and craft, which we were not aware of. People used to knead flour and make small animal models out of that, and even we go to the villages and we find that people are doing, maybe they are not praised for that, but I see small mud toys made to soak and get soaked in the sun so that they harden up and things like that. So art and craft had been an integral part of traditional culture, which we tend to forget. Yeah, please carry on.
Yes, necessity is the mother of invention, and they did that. With everything being available to us, I think we just rely on paying money and buying it. Yes, you're right. Yes, Ms. Subbalakshmi, tell us about how your children, especially those who have either developmental delays or hearing impairment, how easy or difficult is it for you to enhance their artistic skills?
When it comes to hearing impaired children, it is okay. We can actually give them some printing activities, art activities, even clay. You can use clay, fingerprinting, and all that. They would enjoy. They will know how to do it within a frame. They could follow an outline. This could be developed at an early age for hearing impaired children. But when it comes to a autistic child or a children with ID component, then our challenge starts there. For them, just to put a paper together or to fold a paper into half, it is a challenge for the child. But then when we start sitting along with the child, give them extra time and teach them how it goes on, and parent empowerment, of course, that plays an important role, because parents are the key factor there. So they should first understand why it is done, because otherwise they most of the two educated parent, even if we take the child towards craft, the parent will say, ma'am is not teaching me alphabets, ma'am is not teaching me numbers. That is where they again go and stand. But actually we will be teaching numbers and alphabets, whatever the process has to be done through art and craft. So this understanding should be there with the parent also. So first we have to empower them of how it is done, why we introduce art there. So once the parent accepts it, naturally they'll start to sit along with the child. They'll give that extra time for this art or craft, and then that sense of accomplishment when the child sees that colors on the paper or something, the folding and something comes out of it. But we have, of course, for ID children, it should be a very simple thing, just within 2 folds or 3 folds, where we can give them some importance that yes, you have done this, and all that could happen. And of course, when I want to teach, if for example, if I want to teach a child a lexical category of common objects, say a cup, I can use a real object or a picture for that. But at the same time, when I have a paper in my hand, I keep folding it. Gradually, if I just show an outcome of a cup there, it will capture the child's attention for a second. Because for autistic children or IDC, that 1 second matters a lot. for me to put that single word which the child would capture easily. So to capture that attention, I'll need something with me. So this craft work or art plays a role there. So that we can do. That's how this is.
Awesome. I'm going to read a few comments from the live chat. Many people have thanked you for being in this panel. And we have Ms. Raji Indaresan, who is an not origami, Montessori school teacher in Pondicherry. She did mention, or she did compliment all your comments, that Montessori materials are used for slow learners and attention deficit kids, especially in mathematical concepts. And all Montessori materials play a vital role even in high school level. So mathematical concepts, yes, most of the geometry and all those do have uh, uh, a, a role in the origami aspects as well. I'm going to ask, when you talk about attention memory, I'm going to ask Mr. Lokeshwar again. Um, have you forgotten any of the models that you made, let's say 10, 20 years ago? Is it possible to forget, or is it something that can go back anytime and bring it back?
The yeah, the models which are actually quite easy or at the intermediate level is what I can remember. But if the objects are complex to make, something like this alien over here,
Wow.
okay, so it's kind of difficult to remember all the steps because this particular alien has somewhere around 200 steps or something involved. It's kind of difficult to remember all those steps. However, I can remember somewhere around 70 to 80 steps. And also, as and when I do it on a regular basis, is when I can remember it, wherein we don't forget it. So, as I mentioned, this small camel, so I've been doing this camel from past around, from my 5th grade, somewhere around 15 years now, I guess. So I can even fold that crane or this camel blindfolded. Okay, so that's how the physical or the memory that I have. Okay, the other objects, yeah, I've been doing it of late, and quite few. I can remember them, but yeah, as and when you do it, or as and when you practice it, quite often is when we have a good memory over it.
Great, awesome. And let me go back to our special educator, Ms. Subbalakshmi. Tell us about your students' progress and how do you grade them on art, or have you ever come across a stage where this is not working? Does it depend on every child, or is it that arts work only with a specific group and not for the others? That's what I mean.
Definitely not. It should be age appropriate and it should cater to the individual need of the child. That is important. So we have to assess what the child's capability is. Then we have to start with the work. So it could be done for any child depending on the child's level. That's it. There's nothing like the child cannot attain something. But of course, if there might be some restrictions. If a child with say PCP, cerebral palsy comes to us, then you can't ask a child to sit and fold. But then again, you can give the child some other activity which would be appropriate to the child's level, like a printing activity with some support. So if the child has a motor control, yes, we can work on that. So something, or a gross activity like putting a whole hand, print of a whole hand. Such things could be included for the child. So it depends on the child's ability and the restrictions which the child faces. Accordingly, we can work on them. But the planning has to be done by the educator prior to the activity work, to the class, so that we can do such certain things for the child. That's all. But definitely all kids, all children, be it a special child or a normal child, you can always involve them in craft activities. There's no such restriction for anyone. That is what I feel. That is how I've been doing with children also. We have been training even very CP children with heavy issues. Even they themselves, by looking into their activities, the things that they have done, they get an emotional happiness. They're really happy at the output of it. So that itself will encourage them. And then the story part, we can use puppets. to introduce story for children. So puppets again could be made with the help of a child. Just take a print of their hand and then you cut it out, make puppets out of it. So this will help the child to recognize that, yeah, I have done something. My part is there in that program, whatever is happening there. So the child will naturally tend to come into us. They will want to, they'll get observed of what we are teaching them. It could be a story. So if I'm introducing a story, the child will relate it, that something of mine is there. So he or she will start to relate. So that part is important there.
Right. Thank you. And I open the floor for questions. Professionals among yourselves, do you have any questions for the other professional? Please go ahead and you can either ask a question or share your experience with that particular line of profession or anything that you want to share.
I just wanted to add a really small comment to something that Dr. Aditi had said. She had talked about children with ADHD. I have a child with ADHD who's now a high schooler, and we've been through the series of medications and trying different things and trying different therapies with him. But he was one of those that was always a little. He's smaller for his age, and so any medications we tried, it would change his personality. So we found that medications wasn't the right medium for him. And so what you said was very powerful, and it hit me as a parent as well, that medications are a solution to a small problem. So medications are not the solution. And, parents don't always realize that, especially in a medium like in the United States, medication, pharmacology is such a huge part of what we do. With our children, which may not always be the right approach. So, as a parent, we went down that journey, and watching a child's personality change is the scariest thing I think I have dealt with as a parent. So, as soon as you take him off, he's normal again. Otherwise, he'd be this medicated zombie-like character, or just not reacting the way he so that was a huge piece. And then the other part that you said really made that I wanted to just add to, that our brain is neuroplastic, that it is learning, and that we have 5 senses. Along with that, we have 3 other senses, which are our proprioceptive, vestibular, and deep pressure sense. So our ability to know where our body is in space, our ability to deal with movement and direction. So encouraging kids to, I go back to our childhood. We played outside, we tumbled, we climbed trees, we wrestled people to the ground. Those opportunities are not always what our kids have nowadays, because it's all computer and TV and screen. And this is the most exercise they have with their fingers. So, again, realizing that those gross motor development pieces happen when there is gross motor movement, when there is dancing, when there is singing, when there is twirling and twisting and tumbles and crashing into the couch. Those kinds of activities are crucial for any child development, whether that child has developmental disabilities or whether that child is normal child, because of the neuroplasty, yes, allows our brain to develop and grow, but those movements allow our brain to have those experiences. And those are huge foundational pieces that our children need to be able to sit and focus and pay attention. So, as a parent, I encourage, as a therapist, I always encourage parents and caregivers to give children those opportunities, whether they're in a wheelchair, whether they're in a restricted limitation, they're restricted or they have limitations with kind of movements, giving them an opportunity to get down to the ground, being on their belly, tumbling, twisting, turning. Those pieces are very, very, very important, along with touch and deep hugs and squishing them, and those kinds of opportunities develop that proprioceptive input. Swinging gives them that vestibular input, bouncing, jumping, and then the deep tactile comes from the hugs and the touching different things, feeling different sensations. So definitely adding those as an experience to anything that you're doing with a kid is crucial. I just wanted to add that.
And I would also thank you very much. And I would also like to add to it, as you said. So in COVID times, hugging and, playing, wrestling, these things it seems these are getting remote. So we need to fight out COVID and get back to it really. because I would also like to share as a parent and as a physician as well. Most of the medicines that are used, honestly, they're all at the level of research for different grades of disabilities. So it's also important for physicians to stay updated with the most recent uh, publications and things like that, because uh, I have seen, and with due respect to my profession, to my people in my fraternity, people use a battery of medicines, which is not right. Some, and with great knowledge, great acumen, people I have seen prescribing a lot of drugs, and drugs again for their side effects, and then again a group of drugs for the other side effects. So it's kind of a vicious cycle. I think as physicians we need to be alert to come out of that, because I have also seen some excellent physicians to keep weaning their patients off drugs. And we need to believe that developmental disabilities like autism, Down syndrome, cerebral palsy, they are unique, and they are more of conditions than disorders. People are living with these conditions which need to be addressed. It's not that they are always psychiatric issues, they are neurobiological disorders. So, if they are neurobiological disorders or aberrant brain conditions, we need to attune the brain or sync it with the regular flow, for which we have developed these therapies and interventions, special education. So, I think, as I mentioned earlier, also this interdisciplinary approach and time to time assessment of a child is very important. I, being a physician, I do practice dance and movement therapy, but very sorry to say, I have seen some people just playing some music or doing some movements and calling it dance and movement therapy. No, it is not. A therapy must have a therapeutic goal. Then only we can help the child achieve something. Otherwise, how can we just in the blind do something like in the dark, throw stones and just it's not a hit and trial method. We cannot do a hit and trial method with any child. So I request all parents to be very, very much be aware, not only learn over Google, but also use their common sense and also trust their therapists. And therapy is not magic. It doesn't work in a day. It takes time. So if they have introduced their child to some kind of therapy, and also I wanted to mention Nandu, you being there as a speech language therapist, Lokeshwar being there, art and craft to a great extent it helps in development of non-verbal communication, from where I have seen many children picking up speech, coming to one word speech, coming to using different kinds of phonics based upon the models they have worked on. They have and it as it enhances joint attention span, gradually they develop the understanding of non-verbal communication, which transcends to verbal communication. I think you will agree with me. It does happen, and as I say, every child is unique. We cannot predict that this and this there's a set guideline for every child, so we have to give in our best, but we have to keep in mind a goal for this child. And once a goal is achieved, then we move towards the next goal. And I have seen children moving from one end of the spectrum to another with consistent therapy. So my sharing with all the parents would be that trust the therapists, trust the therapy of your child, and trust your child's abilities. Every child has a potential, and do not compare your child development with another child's development. It's good to be aware, but it's good not to compare and think that and build up your own frustration. It will happen if we stay positive. Staying positive is a very big thing for every family, every parent, and that way I think we can transmit a lot of positive energy to the people we work with. Thank you.
Very, very true. Thanks for that advice and sharing the experience. I have a question for you from the audience. There is a question asking, does medication given during early days for a boy, which is 3 days for treating meningitis, can that have an impact on speech and other related issues?
First of all, we need to understand what are the medications that are being given. Secondly, if it is meningitis, definitely the child needs to be on medications. Now, if the child child needs to be on medications and the child has meningitis, then the probability of the child having developmental delays in speech or other issues will be more due to the meningitis than due to the medications,
Okay,
because the brain is affected. So there needs to be medication. So we do not have to think much about if medications are going to create trouble for this child, because first we have to save the brain from meningitis. But yes, meningitis can have a long lasting sequel on this child's brain. So you have to observe, be very aware, and start the interventions after the child gets better from meningitis, recovers. Then immediately get onto it and address them properly.
great. That's a great advice, and I hope Mr. Mehta, you Yugender got that. Um, I'm checking if there's any other questions from the group, from the audience now. Any other questions among ourselves here, different professionals that we have? Any comments? Final
Yes,
words that
I
you-
had a question for Ms. Sublakshmi. So I know that you're a special education teacher, and I've worked with some amazing teachers, but I've worked mostly in the United States. So my experience with education in India is very limited. But I do wanted to ask, how has how has COVID and teletherapy, how has that changed the way you approach your kids, or how you're working with your kids and giving them directions? And so I'm curious. I know how I do it on my end with my profession, but I'm curious how it's changed how you are doing what you do, because I find special education teachers are amazing. They're absolutely worth their weight in gold. So
Actually, we never gave a break in our All India Institute of Speech and Hearing. Right from day one, we have started with the online sessions. Though not directly dealing with the kids, we started to interact with the parents, and we started to give them the instructions, how to go about the learning process, that it doesn't stop there. Because the consistency part is very important for the child. And if you are given such a big gap, again, the whole thing would have gone down. So we saw to it that parents were empowered, parents were taught how to go about it. If the child gave us an opportunity to interact through the online medium, yes, we were able to do it, but not always. So it depended on the kids' level and everything. So on that, we tried to do. Then now we have started offline sessions also. Now slowly children have started to come to us. And of course, we maintain the distance and all that. So all that is being done with needed precautions. We have started to work offline also with the kids now. So the gap had never been there for us. So somehow we managed it. That is how we did.
All right. I think that was quite an interactive session that we had, and I'm glad we had some audience join us too. And let me make sure that there are no more questions. Yes, no more questions. They all thank you for the explanation. So, coming to wind this up, thank you all very much for sharing your words of wisdom and your professionalism, your experience that you've had. And I hope the parents will take these tips that we offered here to understand not to compare your children with others, and just follow their footsteps and see how they are doing. And we specialists are always there for you. You can consult us anytime. And if you need any advice or question, if you have any questions, feel free to contact us through this video. You can put your questions under the comments and we'll try to find answers for you. Thank you very much. And I thank all the panelists for joining us. And we appreciate your input. Any final words that you'll have?
just wanted to say thank you for the medium, and I was going to encourage Lokesh, if he can post some of his videos with how to do origami, I will definitely follow. So again, it was an honor to talk with all of you, and thank you for inviting me to this panel.
So yes, Lokesh, do you have a video library of all that you've been doing?
I haven't, I mean, I just created a email ID for that, wherein I have not created any videos as such. I'm thinking on it. Probably once I start with it, I'll let you know. so that you can start doing them.
That will be great. We all will look forward to it.
Yes,
Thank you
yes.
very much, Inia TV, for having me on the panel. And I really appreciate the good work you're doing in empowering parents and people about these topics. Thank you very much,
Thank you.
all the panelists. Nice meeting you all. And thank you, Dr. Radhakrishnan.
Thank you. All right, I think it's time.
Add that
Yes, go ahead. Yes. Yes, ma'am.
craft will make the learning with a pleasure and not with pressure. So the pleasure part will be happening through art and craft. So that is what I would like to say. And I would like to thank you, Doctor, and the panelists also. It was nice meeting you all. Thank you.
Great. Thank you very much. And we'll see
And,
you again in another.
yeah,
Oh,
thank
yeah.
you, Nandu, and other panelists for having me so that I can share my experience with children who have developmental disabilities as well. And I'm sure that parents, whoever are watching this, had a good knowledge on understanding different things as well. So thank you so much for having us.
Thank you. It is our pleasure. And hope to see you all, audience, again in another series of Loud and Clear from INIA TV. Good night, good morning, good day, good afternoon, wherever you are in the world.